where the culture of health is a bit skewed right now. That why, when I take antibiotics, does no one tell me that I should take probiotics afterwards to rebuild my gut?
Well, I don't know why, because when I grew up, when the doctor was giving me antibiotics, they were also giving me bacterial replacement.
So where did that get lost in translation? How did that get left out of the discussion?
I think that a lot of this has to do with cost. We are being slowly but steadily removing everything that is not strictly necessary.
Picking the flesh off the bones, if you will, of medicine for saving money, right, to be cheaper, it I think leads to this culture in which we only give people life-saving medical treatments. We don't do as much preventative treatment as maybe would be considered common sense.
Right.
Even though preventative treatment might cost less in the long run, that's not what people are thinking about.
Well, but you know, to actually attribute fault for this to the pharmaceutical industry is very short-sighted. The problem that comes from this is not from the pharmaceutical industry. The problem comes from the governments that need to pay for drugs or for provision of services. Or in the case of the US, from the insurance companies that need to pay for those services. So that's why when you have a medication, you often have the generic version rather than the patented version of the same medication, if it's available, because it's, you know, significantly cheaper than the patented version. When I went to medical school, we were taught to think, to look at a patient, make a diagnosis, and find the best treatment for that patient. So when I started working in England, my first paid hospital job was at Cambridge University. And I was running, 30, 40 patient clinics because they have the national health system. And I was writing all these prescriptions for the patients. And then I was getting all these calls from the pharmacy to say, well, we could give them this, but this is like £200. Instead, we could give them that is only £15. And that is one is on formulary, so we can't really give you what you want unless we have like an approval from, I was educated without restrictions. What I noticed in the next generation, because the cost of a health system kind of spiraled so much, is that my next generation next to mine and the following one, they were taught to operate in this system. Right. So instead of thinking about the patient, we've been taught to think about what services we can provide and adapt that to the patient. So it's become less and less and less and less and more to the bone of the essential rather than providing everything, right? Rather than providing a holistic approach, we really kind of do a remedial approach. Because of this high level of regulation, the way clinical trials ask questions is very much the same all the time. It's really difficult to innovate in something that is so highly regulated and regimented, right? Because any form of creativity could be seen as stepping out of boundaries of the regulations. Right. So there's a very fine line here. And then there is a cultural component of people in a consumeristic society that they want results now, and they want it fast, and they want them, without having to sweat too much.
They want the what they pay for to do everything.
Right, and that has another impact. Because the pharmaceutical industry is not operating in isolation. It operates according to an economic model, and there is a tendency to actually give people what they want,
rather than what they need.
Rather than what they need. So, that works at all levels and all directions. But again, to claim that this is a great conspiracy, it's very myopic, and it doesn't take into account all the layers and complex interactions of society, of escalating medical and healthcare costs, and how much insurance companies cost, and how much the health system cost, and so on and so forth.
It's like, in a way, there is a grand conspiracy, but it's completely embedded in culture. It's the myopia that is the conspiracy. We're oblivious to our own biases. You've got this capitalistic system which keeps training people as they grow up that you can buy anything and it's disposable.
Right.
And it doesn't matter when you throw it away, it just goes somewhere. You don't have to deal with that.
Right.
And any technology will solve anything, and if you just have money, you can get whatever you want.
Right.
But when it comes to biological systems like your body, those principles don't work.
Right.
You can't buy your health. You have to work at it. You have to maintain it through your diet and through exercise and through what you do on a regular basis. And even then, you're not an assembly line product. You have a different body from everybody else.
And there is also like a responsibility of Western medicine in this, because Western medicine is only more recently looking at biological systems as a great one, right? As an integrated piece.
Instead of auto parts.
Before, again, historically, we've been thinking about the human body as different auto parts, where even the brain, could be potentially removed without major effects. It's like that there was like this separation of physiological, psychological, and neurological that went on until the 1960s.
It's a bad paradigm, a bad assumption of how everything works.
Right. But now, what I'm saying is that, to me, this is the worst possible time to come into this with this mindset, because, again, even in my own professional career, I've seen a shift in how we look at patients in pharmaceutical research. There is more and more push around looking at biological systems not in isolation, but in terms of how they work.